A stroke doesn't always arrive without warning. Research shows that up to 43% of strokes are preceded by something called a T.I.A, a transient ischemic attack, a warning event so brief, so quiet, that patients dismiss it as tiredness, or low blood sugar, or just one of those things. You get a window, a 24-hour window, and in that window, you have more power to prevent a stroke than at any other moment in your life. Almost nobody does. I've been practicing internal medicine for 27 years. In that time, I've sat with hundreds of patients after a stroke, and I hear the same thing, time after time. Doctor, I did feel something strange the day before. I thought it would pass. It did pass. The T.I.A. passed, but the stroke came anyway. The CDC tells us that stroke is the 5th leading cause of death in this country, and the #1 cause of long-term disability in adults. Over 800,000 Americans will have a stroke this year, and for people over 60, the risk doubles with every decade of life. But the statistics leave out the part that matters most to you right now. Stroke is often predictable, and when it's predictable, it is often preventable. I want to tell you about a patient. I'll call her Margaret, 71 years old, retired teacher, sharp as a tack. She came to me every 6 months like clockwork. Her blood pressure was managed. Her cholesterol was under control. She exercised 3 times a week. On a Tuesday morning, Margaret was making breakfast when her left hand, her dominant hand, suddenly went weak. She dropped an egg. She thought, "How clumsy." She sat down. 30 minutes later, the weakness was gone. She felt fine. She made a mental note to mention it at her next appointment. On Thursday, 2 days later, Margaret had a massive ischemic stroke. She spent 6 weeks in rehabilitation. Her speech recovered. Her mobility did not fully. When I visited her after, she held up that left hand and said, "Why didn't I know to call you?" That question is why I'm making this video today. Margaret's Tuesday morning episode was a textbook T.I.A, sudden brief, one-sided weakness. It resolved. That is what a T.I.A does. It resolves. That is precisely why it is so dangerous. It tricks you into thinking everything is fine, and when you hear a fire alarm, you don't wait. You act immediately. Today, I'm going to walk you through the specific signs of a T.I.A, what to do in that 24-hour window, the risk factors that shrink the window, and the one phone call that changes everything. Let's go through them one by one. Sign number 1, sudden weakness or numbness on one side. Patients assume weakness means collapse. You can't move. You fall down. What actually happens during a T.I.A is far more subtle. You might notice one arm feels heavier than normal. Your grip on a cup of coffee is weaker than it should be. One side of your face, when you try to smile, doesn't quite cooperate. Think of it this way. Imagine typing with a glove on one hand. You can still type, but something is off. The signal isn't getting through clearly. That is exactly what a T.I.A does. It briefly interrupts the electrical signal from your brain to one side of your body. A 2023 study published in the Annals of Neurology found that one-sided weakness is present in over 60% of T.I.A cases. And in most patients, it resolved within 30 minutes, which is exactly why they didn't come in. Your action, if you notice sudden, unexplained weakness on one side, even mild, even brief, sit down, note the time, and call someone. Do not wait for it to come back. Do not drive yourself anywhere. Sign number 2, sudden vision changes in one or both eyes. People assume a vision problem means their glasses prescription is off, or they're tired, or they looked at a screen too long. But a T.I.A that affects vision works differently. It creates a brief blockage of blood flow to the visual cortex, the back of your brain, or to the retinal artery in the eye itself. One specific version is called amaurosis fugax. A patient once described it to me perfectly. He said, "It was like someone slowly lowered a window shade over my right eye. Then, about a minute later, they raised it back up." That curtain drop description is almost word for word what we teach in medical school. Your eye's blood supply briefly switched off, like a light switch being flipped and flipped back. You don't ignore a flickering light in your house. You check the wiring. According to the American Heart Association, vision changes are an underreported TIA symptom, particularly in patients over 70, who attribute them to age-related eye changes. Your action: sudden vision change in one eye or double vision that wasn't there before. Calls for urgent contact with your doctor or 911, especially if anything else on this list is happening at the same time. Sign number 3. Sudden slurred speech or trouble finding words. Slurred speech gets dismissed as tiredness. Family members laugh it off. The patient laughs it off. But the language centers of your brain, Broca's area for producing speech and Wernicke's area for understanding it, are briefly losing blood flow. The result can be slurring. It can also be something subtler, suddenly not being able to find the word you're looking for. Mid-sentence, it just isn't there. Think of language in your brain like a filing cabinet. You can usually pull exactly the folder you need. During a TIA, someone briefly locked the cabinet. You know the word is in there. You just can't get to it. A 2022 review in JAMA Neurology confirmed that language disruption, even subtle word-finding difficulty, is one of the most consistent early markers of TIA in patients over 65. Your action: if speech becomes slurred or you suddenly can't find words you know, especially if it lasts more than a minute or arrives with other symptoms, that is an emergency. Call 911. Sign number 4. Sudden severe headache with no cause. Headaches are normal. Everyone gets headaches. That is exactly why this sign gets missed. A stroke-related headache is entirely different in character. Neurologists call it a thunderclap headache, and patients describe it the same way every time. It was the worst headache of my life. It came out of nowhere, like someone struck the back of my head. The difference between that and an ordinary headache is simple. Your typical tension headache or migraine builds over minutes to hours. A stroke warning headache arrives in seconds, at full intensity. Think of a gradual sunrise versus a camera flash. The flash is what you're watching for. The Cleveland Clinic notes that sudden severe headache is a cardinal warning sign of hemorrhagic stroke, bleeding in the brain, and should always be evaluated urgently, even if it fades. Your action: a sudden severe headache that you would describe as the worst of your life requires an ER visit, not urgent care, not a wait-and-see approach. The emergency room. Sign number 5. Sudden dizziness or loss of balance. This is the tricky one because dizziness after 60 is genuinely common. Inner ear issues are common. Standing up too fast causes lightheadedness. So how do you tell the difference? TIA-related dizziness is a specific disruption of the cerebellum, the brain's balance center, or the brainstem. And the key distinguishing feature is this: it arrives suddenly without any warning. And it usually comes with something else on this list. Imagine a gyroscope. When it's spinning properly, it stays upright no matter how you tilt it. When the spin is interrupted, even briefly, it wobbles and falls. Your cerebellum is your body's gyroscope. A TIA briefly interrupts the spin. The question to ask yourself in that moment is simple. Is anything else happening? One symptom alone may be benign. 2 or more arriving together, that is an emergency. Your action: sudden dizziness with any other symptom on this list is a medical emergency. Call 911. Do not get behind the wheel of a car. Sign number 6. Sudden confusion or trouble understanding. Confusion in older adults gets blamed on fatigue, a UTI, or too much medication. Those explanations are sometimes correct. But TIA-related confusion has one signature quality that separates it from all of those. It is sudden. You were fine, then you were not. You cannot follow a simple sentence. You don't know where you are briefly. You pick up your phone and cannot remember who you were going to call. What's happening is that the regions of your brain responsible for executive function and orientation are receiving insufficient blood. Think of it as a power brownout in a specific room of your house. The room goes dim. A few minutes later, for a TIA, the power returns. But that brownout was a warning. The American Stroke Association notes that acute confusion is frequently misattributed in older adults, delaying emergency response by an average of 3 hours. Your action: sudden confusion in someone who was sharp moments before calls for an immediate 911 call. Do not explain it away without evaluation. Sign number 7, numbness or tingling that you can't explain. You slept on your arm wrong. You sat in one position too long. Pins and needles. That's the assumption, and it's the right assumption about 99% of the time. But TIA-related tingling has a different fingerprint. It arrives suddenly, it affects one side of your body, and there is no position or pressure that explains it. Think of your nervous system as a fiber optic cable running from your fingertips to your brain. When all the fibers are lit, sensation is clear. When a TIA briefly disrupts the cable, some fibers go dark. That is the tingling. That is the numbness. That not quite right feeling on one side of your body. Research from the AHA shows that sensory symptoms alone, tingling or numbness without any other weakness, are present in 25% of TIA cases. They are among the most underreported because patients consider them minor. Your action, tingling on one side of your body that arrived suddenly and with no obvious cause, even if it has already faded, is worth a call to your doctor today, not your next scheduled appointment. Today. Before we get to the action plan, I want to ask you something directly. Have you, or someone you love, ever experienced one of these warning signs and not known what it was? Leave a comment below. You don't have to share details, just a yes or no, because your experience helps me understand what to cover next. Now let's talk about what to do in that 24-hour window. The most important thing I will say today is this. If you experience any of the symptoms we just covered, even if they pass, you are now in a medical emergency. The passing of the symptom does not end the emergency. It may be the beginning of it. Studies published in the New England Journal of Medicine show that the risk of stroke is highest in the 48 hours following a TIA. One analysis found that roughly 10 to 15% of people who have a TIA will have a full stroke within 3 months, and half of those strokes occur within the first 2 days. So here is your action plan. 4 steps, clear and simple. Step 1. Call 911 or go to the ER. Not your primary care doctor's office, not an urgent care clinic. The emergency room. You need a neurologist, a CT scan, and potentially an MRI within hours, not days. Urgent care centers cannot perform the imaging required to evaluate a TIA. Step 2. Write down or tell someone the exact time your symptoms started and how long they lasted. The emergency team will use that information immediately. Carry a small notepad in your bag or use your phone's voice memo function. Step 3. Do not get behind the wheel. A TIA can recur within minutes. Your reaction time may be impaired even if you feel completely fine right now. Call a family member, a neighbor, or 911. Step 4. Know your ABCD2 risk factors. These are the factors that tell your emergency team how high your stroke risk is in the next 48 hours. Age over 60, elevated blood pressure, clinical features like weakness or speech difficulty, duration of symptoms over 10 minutes, diabetes. With rapid evaluation and treatment, the stroke risk after TIA can be reduced by up to 80%. That comes from a 2022 analysis published in the New England Journal of Medicine. 80%. That is not a small number. That is your life. I started this video with Margaret. I want to end it with someone else. In the same year Margaret had her stroke, I had another patient. I'll call him Harold, 74 years old, retired engineer. He came in on a Wednesday afternoon because he said, "Something happened this morning, and I didn't like the sound of it." He had noticed mild tingling on his right side during breakfast. It lasted about 8 minutes. He noted the time. He called his daughter. She drove him to my office. I sent him to the ER from there. 2 hours later, Harold had been evaluated. His atrial fibrillation had been identified as a significant stroke risk factor. His anticoagulation was started, and he went home that night. Harold knew the warning signs. He acted in the window, and 4 years later, he is fine. You now know what Harold knew. The warning signs are in your hands. The window is real. And what you do with the next 24 hours, if they ever come, could change everything. If this video helped you, please share it, especially with anyone over 60 in your life who lives alone. A person who lives alone cannot call for help if they are the only one in the room. Knowing these signs is how you help them. Hit subscribe and ring the notification bell so you never miss out on another video on staying healthy, sharp, and strong. Bye-bye.